Hi, welcome to Steps to Strides with me, Connor Ratcliffe, and today we're in the garage gym looking at some potential loading strategies for peroneals. Today's exercise is a double limb tiptoe raise modified for the peroneals. So, a couple of points off the bat. Typically I'll recommend patients do this on a soft mat or in their trainers. It's just so we don't cause overload of forefoot, particularly with the modified cue that we're going to give to make sure that this provides better engagement for our target structures, primarily peroneus longus and brevis. So if we set up about a shoulder width apart, nice and relaxed, rather than just coming up into a typical tiptoe raise, we're going to give the cue of feeling most of the pressure underneath the big toe, or underneath the ball of the foot, or underneath the first metatarsophalangeal joint if you've got patients who are really into anatomical terminology. So we're going to come up for 1, hold for a count of 2, come down for 3 in a typical 1, 2, 3 tempo that you'll see I use quite a lot. So it's easy to remember, and it means we can bias the eccentric phase, which is more advantageous for tissue and capacity changes broadly. So we're going to come up for a count of 1, hold for 2, feel most of the pressure underneath that big toe, and then come down nice and slowly for a count of 3. Feeling the pressure under the big toe joint and the ball of the foot, and come down for a count of 3. If we turn around and look at this from behind, note I'm sort of holding onto my barbell here just for a bit of extra support. Sometimes you might want your patients to do this, sometimes you might not. But this just means that I can focus on that movement and the quality of movement without the extra demands of stability. But in certain cases, sort of combining the strength and stability demand might be worthwhile. But again, that's patient specific and what you're aiming to do with sort of your overarching treatment plan aims. So we're going to come up, hold for a count of 1, 2, and then come down for a count of 3. And in this position you'll see the difference that it makes through sort of my calcaneal position. So if I do this without really thinking, I'll come up into that position. If I feel the pressure under my little toe, I go into this position. But when we engage our cue, the feeling the pressure under the big toe, that's when we get that bit more E version, and that's when we'll get to target and bias the load to our peroneals. So we're going to come down nice and slowly, pressure under big toe, and you can see the difference that makes in heel position, and start to see why we get better engagement with our modified double limb tiptoe raise. We just have a look at a rep from the side, and again when I do this unbiased, it puts me into this position. When I engage my cue, then I really start to feel that engagement, lateral leg and lateral compartment. And this is another thing we can look out for, we can feel for, or we can advise our patients on. So you should feel it here. You should feel that engagement. And that is our modified double limb tiptoe raises for the peroneals.